I'm going to hit record. All right. Good afternoon, everyone. Thank you for joining us after this long holiday weekend. Hope you had a good one. We are excited to present the second seminar in our Phases Data Core seminar series titled, You Have Data? Now What? I am Renee Moore and excited to co-present with other Data Core team members, Jess, Lindsay, Dan, and Jonas. And that, I'm going to turn it over to Lindsay.
Okay. Next slide, please. There we go. So the Phases Data Core leadership has been a really exciting and fun partnership of the Policy Analytics and Community Research Program / Policy and Analytics Center and the Biostatistics Scientific Collaboration Center. This has yielded so much energy around opportunities for the uses of data and how we can think about collaborations and projects moving forward. So we are here together today as one unit, but hail from two separate components of work at Drexel, both of us with, I think, quite complementary and exciting areas of expertise. Okay, so Renee so wonderfully put our title today, Now What? So we build this seminar today upon our first seminar, which was held in the fall, where we talked a bit about how you can find data sources and how you can think about some of the preliminary steps for thinking about pursuing a research project. Today, we move that forward. We take the next step in working on what you do once you have data, when you have a sense of a data source, when you have an idea for what you might do with a data source and a project that you may want to support. And so we collectively will be presenting to you today tools to think about this next step and are here for ongoing collaboration to be able to continue building together.
Yes. So again, we're going to start with having the point of having data in hand. No worries if you weren't able to join us last time, that we can provide a link to reach out to see that seminar, as well as we are here for you, as Lindsay said. And we're going to start from a common place today about having specific research questions. So as we know, there's data and there's research questions. We researchers have lots and lots of questions, but does the data that we have on hand now allow us to answer a question? Or perhaps we might have to frame our question differently based on the data we have. So you want to have your research questions, obviously should be interesting to you, and making sure that your data is poised to answer the research questions you prioritize. And so we're going to start with two motivating questions, and we're going to run through the different tools on what, now that you have data, what you want to think about with these research questions. The first one, effectiveness. Is the effectiveness of treatments for hypertension different for young adults with autism compared to the general population without autism? And a second question we want to have in mind as we go through these different tools is prevalence. Do the rates of hypertension differ between young adults with autism and young adults without autism? So on the next slide, we're going to break these down a little bit. Lindsay?
Yeah, here we have some color coding to help think about constructing research questions that can link to aspects of your data to ensure viability. Do you have the data that can get you to answers to each of the components within these questions? Focusing first on effectiveness, we took that preliminary question centered on the effectiveness of treatments and sought to break it down into what elements of data and what ways would you pursue your research steps to be able to answer this question. The first component is effectiveness, and that's our outcome. That's what we're looking to measure happens across the components of the research groups. The next component are treatments for hypertension. And so you would need to be sure that your data source and that subsequent steps in your research process look to examine that with or without and possibly amounts of treatments for hypertension are included. We also have groups that we're comparing in the light blue. In this case, in the effectiveness question, we're comparing autism to the general population. And that helps us to ascertain what are the differences that are happening across these groups in this research area. And then finally, we have a condition to focus upon in terms of hypertension, and that being the center of what we're looking to examine.
Thanks. So looking at the prevalence, we have the same colors. And I'm actually going to go in a different order than Lindsay, which shows sort of how we come at things differently. And so for me, I start with the what. What are we interested in? That's our condition of hypertension. And then in who. Who are we seeking to find out information about? Hypertension, how does it differ? And here in our prevalence question, we're interested in hypertension in autism versus the general population, those without autism. But again, hypertension, what about hypertension? And here we have it's a prevalence question, so we're interested in rate. And so that would mean we're looking for a data set that would have rates. And again, we could talk about incidence, we could talk about prevalence, but we're interested here, prevalence, right? So differentiate again, what type of rate. So rates of hypertension in those with autism and those who do not have autism. And so we're looking for a data set that has all these components, or we already have a data set and we're looking into that data set to see if that data set has these different steps, components to answer the research question.
All right, so part of the process of we have our data, what are we gonna do with it is building a team, finding collaborators, figuring out who's gonna work with us on this process. So this doesn't necessarily happen at this moment after you've made the research questions, but it happens throughout the whole process. But we'll talk a little bit about finding the right team. So who do you want to work with you? Where are they from? What do they do? And then the other part of the team, which is getting things moving, having things run smoothly. So why do we want to collaborate with people? There's some of us out there who maybe could do it all ourselves. We can go from start to finish and then get the whole thing done and maybe be really quick about it since we're not having to wait for other people to email us back. But collaboration brings a lot of positives with it. I think, we maybe hopefully have all had some positive collaborative experiences, but one big thing that we get from collaboration is diversity. So we get diverse perspectives. So people might be different disciplines, they might have different backgrounds, they might have different experiences, different positions, different positionality. People have different expertise. So this could be any kind of professional, personal, all sorts of expertise can be informative in the whole process of doing our research. And then people bring diverse resources. So some people have a huge university backing them and they bring great funding capabilities. Some people have great connections to the community. Some people have all sorts of different resources that can help make the work better. And so all of this diversity enhances the quality of what we're able to put out, and that it increases the impact of what we put out because we've got diverse experiences that can reach a diverse audience. And then the dissemination of our findings will then also be more widespread. Our different collaborators have different dissemination networks, so we can reach more people through having a bigger team. Next slide, please.
So when should you start building a team? Early, please. Don't forget, reach out. This is one of the biggest things. Folks come to the Biostatistics Scientific Collaboration Center 3-4 weeks from a grant deadline, and there's only so much that we can do in that time. Come early. As soon as you're thinking about your research questions, start thinking of the different team members who can we help refine the research question. Again, we have so many questions we want to answer. That's why we're in the fields that we're in. That's why we're in this world of because we have so much we want to answer, so much of how we want to change for our populations and public health. And so we all, as Jess said, bring these different perspectives so we actually can refine the research question. Again, there's an infinite number of questions, but for this specific project, for this particular grant, for this data set, we need to have specific research questions that are achievable given the resources we have, given the time frame we have, given the parameters. And so as soon as you're even thinking of ideas, start developing your research question and say, hey, Dan, I'm thinking about this. Jonas, what do you think? Georgina, what are your thoughts on this? And so together we can come up with this research question and the data source and answer it. And so having your team at the different stages is so essential, and you get the most out of it. So please build your team early. So the who, we got into this, who should be on the team? Looking at your research question, break it down into the components, the ones we talked about, hypertension. Do you have a hypertension expert? And we said in the general population, and then also in those with autism. So do you have an expert who does research or works with those in the population with autism? And better yet, if they've started to think about hypertension or something that they've just followed through their own observations or interested question. We talked about healthcare, right? Depending on where your data is coming from as well. Claims data, don't call me, call Lindsay and Jess and Jonas if it's claims data. If it's EHR data, call Dan. So where's your data coming from? In what setting? Is it the healthcare setting? Is it community? And so again, thinking about your research question, break down every part, break down population, break down setting, and think about who you can have to join your team. Do you need a clinician or someone who provides care? Maybe for the effectiveness one on the treatments, absolutely, probably yes, right? I'm not an expert on treatments as a statistician. Who's the experts on treatments? How should we be thinking of these in our, which treatments should we be looking at? What's fair to look at in treatments when we're looking at autism versus those without autism? So if you're talking about treatments, a clinician, care, if we're talking about claims data, someone who would be familiar with the ICD codes and billing, for example, and what codes would lend itself to hypertension. Statistician, always we bring different eyes. And one thing I always say, if you can't convince me as a statistician of the so what, who cares, then you're not going to be able to convince study section of that either. And so also, as you're thinking about the data from your eyes or the research from your eyes as an autism researcher, as a high hypertension, as a statistician, I'm trying to break it down and see all the variables in my data set and how that goes into the model. So coming at it from a different angle, and together we make sure we really have all of the pieces in the data and all the team members that we need. And as a statistician, know that we all don't hand it data. I could do data management for you, but you don't want me to. You want one of my team members to do it. They're much more effective, much more hands-on. And so along with the statistician, making sure you have the data experts, data management, and we're going to talk later about data operations. So who should be on the team? Think about all of the components, who can add, think about who's reviewing this and what they're going to be looking for to make sure your team's complete.
And Renee, can I add something on?
Please.
Also? So like just building on what you're saying about having data experts on there, that's like super, super, super important. It's hard to stress enough that you can't know what kinds of questions you can answer unless you know enough about the data. So unless you know where the data come from, how it was collected, what the experience was for the people who had the data collected from them, how it was entered into the system, how that system decides what data to collect and not to collect, then like you're not going to be able to know what kind of questions you can answer with the data that you have. So it's really, really important to have those people on your team. Otherwise, you're going to run into a lot of problems later on, or you might not, someone who does understand what's going on might start asking the right questions, but too late for you to actually get that good score that you want to potentially get funded for your project.
Thanks, Dan. And Dan often is our liaison between those who have the data and in phases. We know one of the projects is electronic health records. And so all of those pediatrician's office, right, they have electronic health records. They have somebody who's over that data, who's going to pull that data. Right. And so Dan, as a statistician, as someone familiar with EHR data, is the liaison often between the data people on the team on the EHR who are actually gonna pull the data and the co-investigators and the PI. So being able to speak both languages, you need someone on your team as well to help in those conversations. Because again, there's certain data things that a data person can talk more directly to. Even on the claims data, you can be like, hey, Lindsay, I want claims data, right? But there's a whole process to that, and taking all the claims data available and knowing what data to pull and creating that analytic data set. That takes so much time, so much work from our data out there, getting down to which variables to answer your question, as Dan said, and creating the analytic data set. Then you want Jonas and his team there to help you to create the analytic data set, and you probably don't have permission to for the claims data and some of the other things. So that last line really, really important as a before thought and not an afterthought.
All right, so I also apologize. Am I audible right now, or is this sound okay? Somebody, it's me, is having concrete work done outside at a very inopportune time, and I didn't like. I'm on this for 1 hour, but that's the way this works. So some ways that we have found collaborators. So we told you you do need to find these people, and if we don't know all these people all the time. So here's just some tips from us about what we've done, and I'd love to hear from you all about ways you found successful collaboration before as well. But one of the first things you can do is starting with your literature review or your Google search on the topic that you've identified. So here we've identified those two components of hypertension research. You find people who have done work on this. You can just contact them and ask if they're interested in working together. Find their collaborators, see the types of people who are doing this work. And we have found successful collaboration this way. And you find people who have had these different experiences and have different expertise than you. And then also use your network. I'm an introvert. I don't really love networking, but everybody can do it. I promise. You probably know somebody who knows a lot of people. We all know those people. And they would probably be happy to connect you to somebody who knows something about this topic. So it's a tried and true successful method of finding collaboration. And then the next note that we want to make is just to rethink about who you do know. So sometimes people that do something different, or what you think is different from what you do, might actually have some knowledge that's useful for the project you're embarking upon. So for example, for this project, we might know somebody who does pregnancy research or pregnancy healthcare as a provider, but they actually know a lot about hypertension because it comes up in that case a lot, and it's really important to treat and to consider the possible risk factors for. So they might be interested in this project, and they might have some expertise about the topic. They also might know about the types of methods we would want to undertake in this case if we're looking at the effectiveness of hypertension treatments. It's another case where maybe they're not doing a lot of randomized clinical trials, so they might have other methods that they might suggest for you to use in this context where you're not necessarily looking to perform a clinical trial, but maybe you are. I don't know. We didn't say you couldn't. So they might have information about that as well. So maybe they'd be interested in working with this with you.
So who else might need to help? So Jess mentioned, why not do it yourself? And we're kind of trained that way, coming out of master's programs or doctoral programs, right? Or finishing your MD. We had to do it ourselves. Okay, now we've crossed the line. We have our degrees. Even students out there, we want you on our team, right? And so you don't have to do it all, and you shouldn't do it all. And so think about doing a project manager. So helpful as a PI. We're the PI. If you're the PI, it's because you have the expertise to lead it. And so we're leaning on your expertise. And yeah, the buck stops here. But to manage all the different pieces, a project manager's a good one. Is like essential to project. If you're doing primary data collection, right? Who is actually doing the collection? Who's on the ground with those collecting the data? And so maybe you need research coordinators or different staff. And talked about students. Students may play vital roles in the project support. There could be a piece of it of the project that would be their master's project or be their doctoral. And so students play vital roles too. So again, think outside the box of who could help and would help. And here we have a note on the bottom, depending on whether you're in a soft money world, hard money world, whether you already have the funding, whether you have the team, you have to think about how will my team get paid. And so depending on where you are with soft money, or meaning that you have to bring in your salary, you have to bring in the salary of your team members versus maybe someone who's in a hard money tenure track. So it may necessitate different team building, timeline, scope, and effort considerations. Every grant, right, there's a feasibility part. What can I do in this timeline with this amount of money, with the staff I have? And that's whether it's a grant or not a grant. Most of us, most of our projects, we cannot say it has an indefinite timeline and I'm just gonna do this forever. That doesn't work, even if you're not submitting to reviewers. And so think about all that too. I say it's a balance between what we want to do in the dream and say this is a piece of the dream. This is a piece of getting us to that dream. And so we have to think about it. This is a step along the way in what we're really trying to do in Amsher.
Okay, so me and Jonas are going to talk a little bit about data operations and management, which is a huge part of having a successful, running a successful research project. You basically can't have confidence in your results. You can't conduct good science unless you pay a lot of attention to your data operations and data management. And a lot of times you can't even get the data unless you have a solid plan in place and personnel in place to show that you're capable of handling the data that you're going to receive from a partner. So just to start out with like why we care about this, so we care about this like partially because there's the rules, right? Like we have rules that are given to us that we need to care about data operations and management and do things in a particular way. But more importantly, we care about data operations and management because it demonstrates respect for the participants whose data that we're using to conduct research and other stakeholders who contribute or who kind of are kind of holding on to the data for folks. And it builds trust with your participants and stakeholders. So if you don't have a solid data operations and management plan, if you're not staffed well enough with people who are capable of handling these things, then it's not showing that you really care very much about the data and all of the work and all of the information that it represents from the people that gave you that data. And also, as I mentioned earlier, it improves scientific rigor, interpretability, reproducibility, and transferability. So basically what this means is that like, if you have good data operations and management stuff in place, then your study is going to be stronger. You're going to be able to say things about your research with greater precision. Other folks will be able to reproduce your research, and your data will be potentially usable in other studies to back other things up or to disprove things. And finally, it saves time. Like if you have these things in place, it saves a massive amount of time. I don't know how many of the rest of you, and we'll go into this maybe a little bit later, have had experiences where you've either inherited a project or you've joined in on a project later on where strong data operations and management policy was not in place from the beginning. And so you've had to do a lot of legwork to kind of figure out what happened to these data. How did they get to the place where they are now? What do they even mean? And it raises questions about the study if those things aren't in place, and creates like a lot of work for you. So just to kind of summarize what data management is, it basically describes how you collect, acquire, store, secure, access, and disseminate data. So basically what this is saying is like, what are we kind of doing with our data? How are we keeping it someplace, and how are we going to organize it? And teams can support data management with pre-project planning. So you want to make sure that before you start, you have an idea of what you're going to do, building code and data documentation, building policy and protocol, and having someone who's responsible for enforcing or making sure that policy and protocol are followed. And starting your project following these best practices instead of recovering it later. And I will add to this, as Renee was talking about earlier, that staff is a really important part of this. If you don't have someone whose job is to be responsible for this, then it's probably not going to happen. That you need to have the resources in order to make sure that these things can happen, or they're not going to just magically start existing. So one new bit of data operations and management policy that's in place now is that the NIH earlier this year implemented a policy requiring grant submissions to include a data management and sharing plan. And this is a pretty basic requirement. They have a template for you that has like a few questions that you can answer about kind of how you're going to manage your data, how you're going to plan for sharing your data later. And what this plan stresses is the findability, accessibility, interoperability, and reuse of data. So this is based off of FAIR, FAIR principles. And this is a whole kind of school of thought for thinking about data. But basically, like, this new policy exists to make researchers think about how they'll produce, store, and share their data while considering these principles. What the NIH wants to avoid is a problem that has recurred in research for a long time, but has recently gotten more attention, which is that studies are not always reproducible, and the data that were used to produce study results are not always accessible, or they're not always accessible in a way that doesn't require a massive amount of labor. So this is making sure that kind of documentation and the data are in the right place so that the research that the NIH is funding is robust and reproducible. And also so that that research can be built on. The NIH has a template for building these plans and a growing library of example plans. So if you have a particular type of study, a particular type of data you're trying to use, the NIH might have an example plan pertaining to that. That could be really helpful for you. So just a few things to think about for data operations and management relating to code comments and code books. So these are ways of sort of documenting the work that you're doing and the data that you have to make sure that if anyone were to look at your data or your code, that they could sort of figure out what was happening with it. So I want to ask a general question both to our immediate team, the data core, and to anyone else who has an example of, have you ever inherited a poorly documented data set or poorly documented code, and what was that experience like? Would anyone like to jump in?
Oh, which one do I share? There's so many. I think so. The ones that were the worst for me was a team member who has left the team, and I didn't get the chance to check the documentation, and can't get a hold of the person, and literally it takes months. And so in order to uphold the rigor and reproducibility, we basically had to start from scratch. And that is a painful process. And instead of being able to move on, now we're like 2 months out before we can even get to where we were before.
Yeah, and Renee, were their results published based off of that data before you joined on that project?
I've had the cases where things were came back with reviewers, and we weren't able to produce it. Actually, something just happened on a team I'm on a couple months ago where well, a team I'm on now, and it just came up a couple weeks ago, that the team member was a student, pulled their own data, didn't have it QC'd by the stat team, and submitted to reviewers, and due to questions asked, went back and couldn't reproduce it. And it turns out that it was a merge issue in merging the data sets. And so we had to recreate the analytic data set and redo the analysis, and the results are different. And so now I have to write back to the editor to, you know, say, hey, and sort of crafting that to say, hey, you know, that's a hard thing to craft. Because you
Mhm.
can't be like, I merged wrong, and so the results are wrong. You have to be a little bit better. So that literally just happened a few weeks ago. That yes, the results differed because the analytic data set was not created correctly and created in a way that was reproducible.
Yeah, and that's really scary and embarrassing. And yeah, it's something like this is the kind of thing that keeps me up at night. Like, so like when I'm working on something, I want to make sure that everything is in place so that it's transparent what's happening in a data set and with code. So like the code says explicitly on it exactly what it's doing or what it's supposed to be doing. And the data set says exactly what's in that data set and how it was derived, so that if a team member leaves and we come back, that and someone else joins on, they know exactly where to start from, exactly how to look at different things, and also so that if there's quality control that needs to happen, anyone can look at it and do that quality control. Because um, like Renee was saying earlier, like you can't do everything yourself, and it's bad to do everything yourself, especially when it comes to quality control, because you become blind to certain things. Um, and so if you don't have that second set of eyes that's actually capable of understanding what you've done, then you're not going to be able to conduct a good enough review of your project to be confident in its results. So this is my last slide before I'm going to toss it over to Jonas, but just to give you an idea of what should be in a code book and in code comments, at bare minimum, a code file should tell you why it exists, what it does, who created it, and when it was created. There should be a lot more in that code file than just this stuff, but this is like when you create your code file, you immediately put all of these things down. As you're writing things in your code, each section should have like information about what it's doing and why you're doing it, so that someone can follow their way through your code without even knowing very much about it. Code books should give you all information that you need to understand your data. So it should cross-reference variable names, descriptions of those variables, the data type that they are stored in, how the variable was derived, if it was derived, the units of measurement, if that's relevant. So like if I want to know kind of like what the units of measurement are for like a food that's in my database. I want to know if that's in like grams or ounces or pounds. That's all going to make a big difference on how I interpret those data. We also need to know how variables are coded. So if it's a categorical variable, 1, 2, 3, 4, 5 in there, we need to know exactly what each of those codes means for interpretation later on. And I link a couple of resources here that when we share the slides, you'll be able to look at that give you some more ideas about these things. Off to you, Jonas.
Thanks. Yeah, so I'm going to talk now about, setting up data operations. Just to give a little bit of background, I run about a 5-analyst team over at PAC. And so I'm going to talk kind of through my process of running data operations when a new project is coming in. So the first thing that I always have to think about is the policy and security protocol. So what DUAs or IRBs are involved in that data set. And I could talk about all the PII, but I just want to highlight some more unusual things to think about that we've faced at PAC. So one is access. So some data sets like CMS, which is giving you the raw healthcare claims, do not want you to provide access to the door to wherever the computers are being used that has the Medicaid data, which makes sense. However, your property management does not want there to be a door in their building that has a key that they don't have access to. So negotiating that has been a process that we're still navigating. Other things like international travel. You can't have access when you're not in the US or its territories to Medicaid. So if you have remote access, when you go international, you have to work with IT to remove that remote access. So all of these are important in building your team, but also thinking about while you're working, while you might be mid-project. And then just kind of going off our example of the prevalence of hypertension, I wanted to pull 2 data sets. The first, which, well, HCUP isn't one data set, it's a group of data sets. But using HCUP data, which is a healthcare and utilization project, they have a few data sets. The one I'm going to talk about is NEDS, which is the National Emergency Department sample. So their data does not have DUAs that are strict to the point that CMS does. So you have to take a course, but after that, their data is already essentially de-identified through complex survey methods. But you can only get national estimates that way. CMS, on the other hand, you can get state, you can get lower level than that estimates, but you know the DUA is strict, and so you have to think about who's even allowed to touch that data that can also you know, estimate that. So there's always upsides to every data set. And so you just have to adjust by what you have. Next slide. I think the other thing is to think about what analyst you're working with. And so for me, for example, I have 5 analysts with different backgrounds, different trainings. So they've worked with different types of data, primary versus secondary. You know, some have worked with claims, some have worked with EHR, some have done complex survey methods, which is more of it, which is a secondary data source, but kind of tracks like a primary. Then source of the data, like we said, security, who's even allowed to touch that data, use that data. If you have the perfect analyst, but they're not allowed to see the data or touch the data, that might not be a great fit unless you have somebody who's worked with that data for years and can code without seeing it, which is an unusual skill, but some people like can really do that. And then what methods are you doing? Are you doing more complex? Is it just a demographic? Is it longitudinal? These require additional expertise past what you would expect just anybody to have. And so all of these together, oh, and then lastly, coding languages. So for going back to our example, HCUP data can be processed with almost any program. I'm going to say almost any, because our 4 main ones in our lab can all, which are Stata, R, SAS, and then SQL can all use that data. Now, when you look at CMS, SAS becomes the only one that can really handle that size data, given powerful but not supercomputer level backend. So knowing what languages your analysts use or an analyst you're looking for can be really important. Next slide. And then I just wanted to talk about that, you know, everything I was just talking about is finding the analyst for a single analyst for a project. But sometimes you might have multiple analysts working on the project together. And so these are just some lessons learned, shall I say, from having to go this route. Try to make this decision early on in the process rather than later. If you know you're writing code and you're building something that you're going to pass off to another analyst, your code is cleaner, your documentation is better. It really puts you in the mindset that this has to be ready for somebody else to take. Code books, code documentation, we've talked about it, super important. But I think also making sure that you have time to communicate live and ask questions and like scroll through the code and not just rely on those two is better. One thing that I personally do is I like to have whatever point that the analysts are meeting on, try to build the bridge code. And by that, I mean the code that's that step before the data transfers hands. This happens a lot more in our projects where we're using 2 data sets and 2 different analysts are analyzing each data set, and we need to make sure they have the same cohort, or they're getting a cohort from one data set and it's going back and forth. If you have both analysts do that step and make sure they're getting the exact same sample, that's one way you can ensure like all the sample requirements and both analysts understand where their sample is coming from. And then lastly, I'll say there's always this big push to kind of, or not big push, but it seems like a feeling that analysts don't always need to know anything really outside of what they're going to code or outside of what, you know, specific analysis they're going to do. But knowing the big picture, knowing what somebody's going to take and do with your code or your sample or whatever you've generated after is just as important as knowing what you're working on. Otherwise, you won't ask questions about certain things that might come up, or you might see a flaw that's going to impact down the road. It's harder to create, to catch that early.
Okay, so another part of your journey with this project might likely include the application for funding. So we'll talk briefly about 2 aspects. So how we might find funding that's appropriate for our questions, and then going about building a proposal briefly. Next, please. So just highlighting here 2 general types of funding that are commonly sought in autism research. So we've got federal funding. I'll talk a little bit more about what's funded where in a little bit, but National Institutes of Health are a huge funder of autism research. Health Resources and Services Administration, the Department of Defense funds autism research. I feel like I realized I stopped. I left off a little here at the bottom. The Patient-Centered Outcomes Research Institute is a other source of funding. This is a typo. So that's listed twice. Sorry about that. So we've got federal funding, and then there's other sources like foundations that are nonprofit foundations that will fund autism research, other science foundations that do this. So Simons Foundation is a big funder of autism research. And then there's other organizations that are beginning to fund more and more research that may be, you know, sort of typical scientific research. Sometimes it's a little bit different and they have a different angle. They have different goals as an organization. So the type of work that they fund is different based on meeting their needs and what they think is important. Autism Speaks will fund a great amount of work. And then there's also a lot of other smaller funding sources that you can find. Drexel itself has a lot of internal funding mechanisms. One that we just received not too long ago, a couple weeks ago, was about the Drexel SALIS Aging Pilot Research Awards with the new, I guess, transfer of SALIS to Drexel. I'm not exactly sure what the word is for that, but they're, you know, funding new research opportunities to try to capitalize on this new team that's joined Drexel. Next source, please. So the Interagency Autism Coordinating Committee is the federally convened board of people that tracks and makes suggestions to the federal government on the type of autism research that should be funded. So one of the things that they do to help in this goal is a portfolio analysis. And in their most recent one, which was 2019-2020, they tally all the money that's been spent on autism research in this time period and where it comes from. So this graph is showing that 82% of funding for autism research in this time period came from federal sources. And then the rest came from private sources. But something that I think is interesting to point out is that the number of projects from federal was 800 or about 900, while the number of projects for private was about 700. And those really aren't so different. Suggesting that a lot of private funding might be funding smaller projects. So sometimes private funding is a great place to look when you're trying to do a pilot grant or a smaller research study that can be funded with less money. It might be very successful from a private funder. Next, please. And this is just a little bit more detail on who specifically funded. So the biggest one here, the blue, about over 2/3 of money for funding for autism research was from NIH. And then the second biggest one at 13% was the Simons Foundation, which is one of those private foundations that I identified. And then a small percentage of other things. So CDC, Department of Defense, the Department of Education. So a lot of variety, but still a lot of big projects coming out of the NIH for autism research. And then a little bit on how to find funding. So the first place to start here is probably to talk to peers, people in the field, mentors that you may have that can identify sources of funding that they've been successful with in the past and things that they've seen come across their desk. Just a connection to the general landscape of funding opportunities. Something that you can then do yourself is to evaluate successful grants that have been successful in certain grant mechanisms. So there's a bunch of different things you can apply for, and some will be more successful in certain areas than others. But you can find these through NIH Reporter, where you can Google mechanism, you can Google name, as I've done here, you can Google key terms to see if work's been done before in this area. And then all the research you cite will, if it has funding, will have the funding attribution there, and you can see what kind of mechanisms they used. And then once you've seen what's out there, you can begin to identify specific sources and mechanisms for your work. You can find the funding schedules. Some, like NIH, are very cyclical. Other organizations are sort of cyclical. So like the HRSA, the Health Resources and Services Administration, has a secondary data analysis grant, and they put it out mostly every year. So you can always look for it around the middle of the summer, but it's not always released. You can always sign up for the organization email alerts, which are really helpful, and they usually give you a lot of warning and then tell you about all the other infrastructure they have to support submissions, like webinars and stuff like that. Next, please. So then for our, I'll get into that on the next slide. So something to think about sort of generally is matching the mechanism that you find to the grant idea that you have, or the research question that you have. So you need to find a mechanism that's looking for what you are proposing to do. Sometimes we do it a little bit of the other way. So we might find a mechanism that seems like a mostly good fit, but we maybe need to tweak our question a little bit to really get at the goals of the mechanism. So maybe they have a goal of looking at health disparities. So you might need to add that to your research questions to be successful in that grant mechanism. And it's probably a good thing to examine in this context anyway. So also, as you're developing your proposal, you might think about what you are submitting in sequence. So maybe you have a larger research question, but you found a mechanism that fits really well for the first part of your question, and you might decide to submit for a small grant and then submit for more funding in the future based on what you build through this pilot or smaller grant in the beginning. And then, as Renee was talking about it at the beginning, really identifying the so what of your research question is really important in the funding application. And if you can convince people why this is important and why this will lead to future work and to improve health and all the important things down the road, you'll be more successful with the submission and with your layout of your research agenda. And then once you identified all those things, you can contact the program officer at the organization you've identified, or whoever might be assisting with the grant submission process that can answer your questions about if your submission is a good fit, things you might need to think about before applying to that given mechanism. Did you want to join in, Renee?
Oh, just was doing a time check, 12:52.
Okay. So just really quickly then, I've just highlighted, and we're sharing these slides anyway, where we might apply for these specific questions. So the main point is that our treatment efficacy and our prevalence question are different, and they might have different, they would have different homes. They'd be successful at different grant mechanisms. So we would think differently about where those would be submitted. And then as an example for the prevalence question, we might decide to do a larger project that might be more fitting for an R1 or something, a larger, more money, longer time period. Or maybe we want to do a smaller grant that's maybe a year, a little bit less money, that really focuses on one specific aspect of the question. So next, please. You can go to the next one. Thanks, Jan.
Okay, I think I'm just gonna buzz through these because of time. But this is just a reminder that there are a bunch of different kinds of data, as Jonas pointed out earlier, each requiring different kinds of expertise. And a lot of these are really, really complicated. So it's really important to have someone on your team who understands these data so that you can make sure that you're building a strong research project.
This slide is just acknowledging our different funders
Yeah.
of the work that we're doing. And so just want to acknowledge that. And then a few minutes left for questions, as well as we will put in the chat the link. We'd love it if you'd fill out our survey to put to let us know what you thought, let us know perhaps what you'd like to hear more about. And Kathleen, yes, please.
Hi, thank you. That was a great presentation. I just wanted to mention that both for identifying funding sources and potential collaborators, we subscribe to a database called Pivot Funding Discovery. We being the Drexel Libraries, I'm sorry, that allows you to create a profile for yourself and to construct sort of queries of what kind of funding or collaborators you're looking for. And then it will continue to send you potential matches for what you need. It's really a great resource, both for finding funding opportunities and for identifying people who you might be interested in collaborating with.
Thank you, Kathleen. That's really exciting. I don't know if you have that link handy to drop.
I am putting it in the chat for you.
Thank you. Thank you.
It's listed from the library's databases list.
Thank you. And thanks so much for joining us. I feel like I heard about that. And so now you confirm the rumor is true. So thank you. That's a really powerful.
Hey, it's a good resource to know about.
Absolutely. Thank you. Others have anything they want to share, comment on, or ask questions about? Thanks, Elizabeth, commenting in the chat. Thank you. Well, thank you so much, everyone. Thanks, Georgina. We'll stick around for our 3 minutes and give some of you 3 minutes back before the next 1 o'clock appointments. Thank you so much for joining us, and thank you to all the co-presenters.